Good morning. Thank you for being here. Idaho is currently reporting 9 confirmed cases of coronavirus. Counties with confirmed cases include Ada, Blaine, Madison, and Teton. The situation with coronavirus is changing hourly in Idaho and elsewhere. Our focus remains the same: to slow the spread of coronavirus for 2 main reasons. First, to protect the elderly and the health compromised, and second, to preserve capacity in our healthcare system. This is a very challenging and uncertain time, but I want to assure Idahoans we are working around the clock to expand access to testing and ensure we can handle the many, many aspects of our lives that are impacted by this situation. Idaho will adopt the White House and CDC's latest guidelines, which they are calling 15 days to slow the spread. Through the end of the month, I encourage Idahoans to do the following things. Do not visit nursing homes, retirement homes, or long-term care facilities unless to provide critical assistance. But still, find alternative ways to connect with loved ones in these facilities, like phone, text, FaceTime, and others. Avoid discretionary travel. Avoid social gatherings of more than 10 people. Continue to practice good hygiene. Work from home whenever possible, unless you work in critical infrastructure industry, such as healthcare, medicine, and food supply. Take advantage of the many drive-through pickup or delivery options for food. Businesses are stepping up to make these options even more available than before in order to serve customers and to keep people working. These are all best practices to keep you and your neighbors healthy. I am not mandating categorical closures of schools and other establishments in Idaho at this time. I leave it up to local leaders and operators of those facilities to make their own judgment calls about whether to do that. Idaho is a very diverse and expansive state. A solution in one area might not be the solution in another part of the state. Right now, our state public health experts and CDC tell us that schools should be closed in areas with community spread or immediately surrounding areas of community spread, or if coronavirus has been identified in the population associated with the school. That could change, but that's the situation right now. It is critical for Idahoans to stay home if you feel sick. Call your medical provider if you think you should be tested for coronavirus. If you are in the category of a vulnerable population, elderly or health compromised, definitely stay home and away from other people for the next few weeks. If you are a caretaker, be cognizant of your risk profile. I know this situation is very hard on a lot of Idahoans. I urge us all to think about each other right now. If your neighbor is a vulnerable part of the vulnerable population, ask them how you can help. If you know a healthcare or public safety worker who needs child care or help taking care of things at home, reach out to them. We absolutely need to maintain a strong healthcare and public safety workforce right now. Please do not hoard groceries and household products. America's supply chain is the strongest in the world. Grocery stores will stay open and will be continually restocked. Shop for your needs and no more. You are potentially harming your neighbors when you take more than you need. Everyone should seek updates and resources from official sources of information. Our website, coronavirus.idaho.gov. As I mentioned in my message yesterday, history will remember how we dealt with coronavirus. Let's make sure future generations use it as a model for calm and compassion in a time of uncertainty. With that, I'll take your questions. Yeah, yes.
You have said in some of your recent press events and on the teletown hall yesterday that you are looking into child care options for those that are needing it. What are you planning with that?
We are actually We're looking at licensing flexibility, to funding support. We're working with our state and federal partners. I didn't plant this question. To understand what options are available. If facilities have specific needs that allow them to operate more effectively during this time, we're encouraging them to call the Department of Health and Welfare to explore funding and licensing flexibility that may be helpful in their unique circumstances. For the people that are, have dialed back, but may be thinking about closure, addressing childcare is a big issue. That's frankly part of our critical infrastructure is my healthcare workers. They have to know that there's an options for them. So we think that's critical. All the states are struggling with this. We're trying to give maximum flexibility to the licensing. The state doesn't license child care, but the cities do, and we're having a conversation with them about that.
With your recommendation on groups of 10 or fewer, are you asking the state legislature to wrap up today?
I've had multiple conversations with legislative leadership. I think it's their intent to get out of town today. Keith?
Of the 9 cases, are any community spread at this point? Has that been determined?
No.
No, that it hasn't been community spread, or no, it hasn't been determined.
Well, it hasn't been determined.
Governor, you mentioned that you've talked with legislative leaders and that their intention is to get out of town today. But under the Supreme Court decision a couple of years ago, legislative leaders have been clear that they feel they need to remain in session until they've gotten all their bills to you so that they can respond to vetoes. How will that play out?
Well, that's up to the legislature. In Rick v. Denny, I read that last night, some of my nice reading. Read the entirety of the lawsuit last night. They, under their interpretation of it, and under it, they're saying that they need to stay here. Just this morning, I got a few bills on my desk. I am trying to process those bills as fast as possible. It's up to them to, quote, deliver the bills to me as per that guidance. But I will not be an impediment in that process, so that's up to them.
What do you mean you will not be an impediment?
That means we will process the bills as fast as they come here. So I assume that they will, given the criticality of social distancing and the need, I think it's incumbent upon the legislature to expedite getting the bills down here as fast as possible, because then they can fulfill that delivery hurdle that is part of Rick's v. Denny. How do I do, Mr. Secretary?
Very good.
Yes.
No, I was just wondering.
Can I ask a question of Dr. Hunt?
Oh, yes.
Doctor, last week you had indicated that the latest information of the mortality rate of coronavirus is about 1.4%. Has that changed at all? And then I've got a follow-up question.
Yeah, so the question is about the mortality rate estimate of 1.4%. Different publications are using slightly different numbers, but everything's hovering right around that 1% that I've seen in the coming out last few days. Literally, we have 5 or 6 new studies published every day that I've been trying to keep up with, and that's the number that seems to be still out there.
Chris, why don't you talk about what we just talked about later, about statistical model?
Yes. We talked about a lot. Yeah, so we are very aware that we need to be able to project out how many people might become ill, hospitalized, and potentially need critical care in the coming weeks and months. It's very hard to predict because so much of it depends on what we're doing in Idaho, and as the governor just announced today, changes are happening so frequently, it's very hard to predict in the future, but we're constantly changing. We need to change to stay current with the recommendations. But we are going to be reaching out to our universities to help us with some of that modeling, so we have a clear picture as possible, and that we are nimble enough to keep updating those estimates on how many people might end up in the hospital, how many people, when will our peak be? If we implement these tougher measures that the governor announced today, hopefully we'll be able to really reduce the burden on healthcare, reduce the amount of illness in Idaho. So we're going to be reaching out today and really getting those formal conversations started with our universities.
Any of the patients that have been confirmed in Idaho yet, have any of them been hospitalized?
Yeah, so the question is about have any of them been hospitalized? There are 9 cases. Yes, 2 of them have been hospitalized. To my knowledge, as of today, they're both doing okay. You know, I didn't get an update this morning, but to my understanding, they're both doing fine. They're recovering.
And then this may follow on the conversation you had with the governor is the mortality is around 1%. Is there an estimate for the percent that might become sick enough to need hospitalization?
Yes, absolutely. So, right, so the question is what percent might need hospitalization, and that I would direct you to, in a little bit way, that's particularly challenging because the data from other countries reflects cultural differences in who might need hospitalization and what triggers they use to hospitalize patients. So we don't have a firm number on that. What we're going to do is look at the data out of China, but knowing their healthcare system is so different, I think we're more interested right now in what we're seeing out of Europe. And you may be aware just yesterday, the study that was released from the United Kingdom, I urge you all to read that. We found that very, very interesting and helpful. They looked at the United Kingdom and tried to project onto the United States, but we're literally just digesting that information and we'll be incorporating that into our modeling. But I don't have a firm answer for you on it today.
For Dr. Hahn, actually, is there any indication right now of community spread in Idaho, or are the 9 confirmed cases all travel related?
Yes, as the governor indicated, we do not have any, we are not declaring or have any evidence of community transmission. That said, as you know, every day we're getting new cases reported, so we know that's going to change at some point. But as we talked about before, every time a case is reported, within hours the local health department is reaching out to that patient. As soon as they know the doctor has notified that patient of their result, they're reaching out, interviewing them, determining where they might have picked this up. And so far, we've been able to find some either direct travel or exposure to somebody who has just traveled in from out of state. But we know that at some point, we're going to hit that point where somebody says, I haven't gone anywhere and I don't know where I got it. And at that point, I'm sure the governor will be making an announcement.
Governor, whatever the percent is of coronavirus patients who end up hospitalized, am I correct that the steps you're taking, that you've taken over the last week, that a lot of them are focused on that percentage, that you wouldn't be taking these steps if we were all just going to get mildly sick from this?
Well, that, as I think I've said in both press conferences, there's 2 variables. How fast, well, there's actually 3, how many people are going to get sick, but there's pretty good concurrence over a certain period of time. If everybody gets exposed, until such time as there's a vaccine, and so until other times, there's going to be a certain percent that are going to be, that are probably going to get exposed to this. Some of them it's going to be almost de minimis, and we think that's part of the issues taking place in other areas. There were a lot of people who had subclinical signs. Tell me, have my state epidemiologist tell me if I get off base. And that's where some of this has grown. But we want to spread this thing out to where our hospital capacity. The other thing we're trying to do is increase hospital capacity. Today, our Board of Medicine met this morning at 7:30 about what they can do in licensing, about people that are either retired or other people that are out there, what we can do with PAs, what we can do with nurse practitioners. We're trying to raise the one line where we're trying to flatten the curve, and those are the 2 things we're working on.
Governor, I know these are recommendations. Do you foresee down the road maybe taking more serious steps and issuing some types of orders limiting social interaction?
Yes.
What would those be and what would
Well, it depends. I mean, there are all these variables, and that's what we talked about. As these variables change, what we need to do will change. So It all depends. We have the benefit of learning from other countries and other states, given the fact that we were one of the last states. So the good work that Health and Welfare and Dr. Hahn and our group have put together is we're preparing for that. But you know, it's a mathematical calculation. If X happens, we do Y.
And then how happy are you with the way Idahoans are responding now to your suggestions?
You know, I am, for the most part, pleased. I think, I mean, this is a very stressful, you know, turn on any of the major media. It's, you know, I'm concerned about the stress level. I'm concerned about these people being home. I'm concerned about people being off work. I'm concerned about people who a week ago, you know, might have been just trying to get their economic nose above the water. And, you know, there are a lot of stress factors out here. And given the stress factors, I always have great confidence in the resiliency of Idahoans for a variety of reasons. I think what Congress did or is doing today will make a difference. There'll be some sort of an economic safety net that we're still trying to get the details of. But I mean, given the magnitude of this issue, I think for the most part, most Idahoans understand that we're in this together, and the fact that Idahoans have a natural propensity to help their neighbors, I think is going to be one of the best things we have going for us.
Mr. Treasurer, what advice would you give the legislature as we are still?
These legislators are always interruptions. And they show up late and didn't hear my first answer to the question.
I apologize, sir.
Senator, I said that I talked to, before your caucus showed up, I said that I had talked to legislative leadership, and I understood it was their intent to be out here today, and that's what I think.
Okay, well, majority leadership, so thank you.
Well, I talked to both of you yesterday also.
Along those same lines, Governor, given the guidelines that you're discussing, should we all be here in the Capitol right now? Should the legislative session even be operating today?
Well, we will probably continue to refine how we reach out to the media, and this is just one of those mathematical calculations. One of those mathematical calculations is at X time, when this happens, we do Y. We will probably, if we're like some of the other states and get there, my conversation with my fellow Idahoans in the media will be with more distancing. That's just one example of it. And I'm grateful to the legislature for their some of the technology funding they gave us for all the services of government, including the communications out of my office. We're two different branches of government, and you know, I gave the recommendations. They are, I hope, hours away from consummating their works.
But Senator Winder announced on the floor yesterday that the Senate would continue its work until there was a confirmed coronavirus case in the state capitol building. What do you think of that position?
We are separate branches of government, and I will speak for the executive branch, and the legislature can speak for their branch. Yes?
We seem to be getting a lot of comments at the news agencies, frustrations from people that these are recommendations and not orders for things to be closed. Could you clarify for the people of Idaho why you're doing recommendations and not closures at this point?
I think my text did that. We're following CDC guidelines about what the best practices are. We've learned from other states, and I'm concerned, and I'm sure my friends in the media, they'll start writing about it, about some of these, I could say, arbitrary decisions in some of their areas where they closed everything down, and now they're, you know, the issue of what do you do about childcare? What do you do about, and the big question is, when do you open things back up? That's why we're adopting the White House's 15-day plan that I just went through the points in. But given the dynamics of it, you know, Governor DeWine, I was on a call with him, but you go to a state where everybody goes to work by mass transit, is way different than Idaho, where everybody goes to work in their own automobile. So things are different. As I said, Idaho is a very diverse and expansive state, and what works in Cleveland is not what works in Yellow Pine. Yeah, that's.
I think we've all been hearing a lot of words on media, which I know we all said that it's been kind of crazy, but we're hearing words like recession, unemployment rate, and what do you have to say about what Idaho is going to do for Idahoans, not what the national politics are?
Well, we will do what we've done in Idaho up until 10 days ago. We were the fastest growing state in the union. And how do we do that? We let Idahoans be Idahoans. We let Idahoans be creative. You know, our obligation, my obligation and my legislative partners is to provide the educational platform so that we expand the skill set so we can be adaptive to whatever the needs are. The needs of Idahoans, the needs of the U.S., and the needs of the global market. And we will continue to do that. You know, this is a long game now. What the decisions that we make today, first and foremost, I got to keep everybody healthy to the extent I can. Well, I've got to get that curve down. And second, I've got to say, what's my end game? When do kids go back to school? When do the universities open back up? When can businesses go back and work? So I need to minimize the risk now. You know, I'm sure, and I was on a call the other day that you know, there's therapeutics that are being developed. We don't know what those are. We do know that the development of a vaccine is quite a ways out. But each one of those scientific advances, right now, our issue is supplies and testing capacity. We're concerned about both of those, and we're working diligently to address both of those issues. But as long as we can continue to be resilient, but I'm sure the economy is going to slow down. It's impossible for it not to slow down.
Follow up on that note, what you said about testing and supplies. What do you have to say about St. Luke's coming out and saying they're going to do drive-up testing?
We need to expand that model all over the state. But I want to caution everyone that everybody that wants to get testing can't get tested. There's only a certain amount of capacity, as Dr. Hans talked about in our lab, and there's only a certain amount of capacity in the new labs that are coming on. So those same protocols that we've talked about over and over, if you first go through the list of things. If you think you check that list, get a hold of a healthcare provider. In a lot of instances, they'll do a rapid flu test. And if they diagnose you with the normal flu, then that's a different issue. But if you check all those boxes, we're trying to preserve testing capacity so the people that really need it can get tested.
Governor, have you got any estimates yet on the potential fiscal impact on the state?
No, but it's going to be somewhere between bad and badder.
Has there been any talk about deferring payments on state taxes for businesses or individuals?
We will probably follow what the federal government does. I have the authority to postpone when taxes are due, but we need to look at it from a cash flow standpoint. Yesterday at the Board of Examiners, the Secretary of State and I and the Attorney General and the Comptroller signed off on the issuance of TANs, tax anticipation note, which is normal operating procedure. But if we delay when taxes are due, we have to look at it from a cash flow standpoint. But if we got a problem in Idaho, the other state's got a way bigger problem than we do.